Okay.
We are starting with the next presentation.
Thank you for inviting me. It's nice to be back. So my name is Leonard. I work in the Faculty of Health Science with the Department of Family, Community and Emergency Care, but I'm an artist, okay? And that's why I don't dress like one, so that you don't judge me for being an artist. It could be in that box. A very science-oriented approach, okay? So as an artist, I make a contribution in the specifically in helping people to understand three-dimensional space, three-dimensional volume, okay, in the anatomy, all right, in anatomy. So what we're going to cover in the presentation is how can we better understand 3D volume, okay? So what I mean by 3D volume is like what the volume, the internal volume, plastic, the internal, not for forensic. You are anthropologists, right? Archaeologists, yeah. So I look at the internal volume and the external volume, and these make up three-dimensional understanding of space, okay? Where's that thing now? I had
This is the problem with the clicker, misplacing.
Maybe under the skull, under the head.
Thank you. Thanks. So we're going to look at how can we, and also how can we visualize? That's the important thing, to be able to have an understanding of how can we visualize in our minds what we're dealing with, okay? I'm going to be showing you, introducing you to an online course called Exploring 3D Anatomy. It was designed by myself and my colleague in Newcastle, Professor Iain Keenan. He's the professor of anatomical education at Newcastle University. We've been collaborating since, I think, 2015 on art-based approaches in anatomical education. And then we're going to look at section 2. We're going to go into a bit more theory about observation and memorization of 3 dimensions, the use of touch, the importance of touch, the sense of touch in understanding form and in getting more information and observing better, literally, because you look at something, you look at it. When you feel something, you get a very different set of data. But anyway, I'm just really trying to move on. So this is we will come back to this at the end, so you can scan the QR code. The course is free and you can do it. But first of all, let's see if you want to do the course. So the course has in it different exercises, an astronaut exercise, a body exercise, an exercise using a fork, ordinary household objects that you can use to, and myself and my colleague Iain, we are on the videos. I won't have a moustache in these videos, but you can see us and we will guide you through these very easy to do exercises, and yet they have a profound cognitive influence. You'll be able to improve your spatial awareness, okay, and your spatial skills, and we'll come to what those are. So this is just what the interface looks like of the course, all right? These are the particular exercises that you'll do. It takes 8 hours to do the course, but over some days.
Yes.
And a certificate, but we'll get to that. Okay, this is what the interface looks like. You'll look at this on your screen, you'll have a video, and you'll see myself and Iain demonstrating these exercises. And obviously it's a video, you can stop, you can practice, you can follow along with us. Okay, let's go to some theory. So look, what is a face? This is a Face Science Symposium. What is a face without a head? I mean, a head is comprised of a lot of stuff, right? Skin, cartilage, muscle, then there's bone, there are organs. So a head, there's an artist actually, Frank Albach, he's now just deceased. Very old, he was an older artist, one of Britain's most celebrated artists. When he did portraits of people, specialized in portraits, He used to title him head of so-and-so because he's dealing with the head, right? So, a head it's got an internal volume. That's like what we're looking at from the outside, and it's got an internal volume. Okay, external volume is here, internal volume is everything inside, and that all makes up the face. So when studying a face, it's useful to be able to visualize the three-dimensional structure or the volume of a head as a mental image. So if you could close your eyes, if you're studying a particular head or face, and you could close your eyes and see it in your mind and rotate it, you have a, and look into it, you have a better understanding of it, right? So just some concepts here. Three-dimensional spatial awareness. We all have it. If I want to go from here to here, it involves spatial awareness. It's a cognitive function. It's a mental function. But what we want is to improve our spatial awareness, to improve it in the professions we are in, okay? Then three-dimensional spatial ability, what is that? It results from an improved spatial awareness, okay? A spatial ability is the ability to, if I've studied humorous, or if I've studied a hammer, and using touch, of course, and sight, it makes a visual memory of it, and I can then access that. Okay. And then there's three-dimensional spatial skills, which is the application of spatial ability to do manual and cognitive tasks like patient examination, like dissection, and like whatever else you do in your professions. And this course will help you to do that. So, for example, I just want to give you some examples of the exercises that there are. There's, by the way, the course is free, so I'm not here selling you anything because you don't pay for it. It's free. It's called a MOOC, a massive open online course. It's been done by lots of people throughout the world. It's available throughout the world. Yeah. So this is simply a jar exercise. Now, why the jar exercise? Let me just show you. Oh, I'm looking at the next screen. Okay. So why the jar exercise? Have you all studied this at some point? Now, this is represented on a two-dimensional book flat surface or screen, okay? But it's representing it's representing the human body in its three dimensions. So how do we learn that? How do we get an understanding of what these three dimensions are? We simply take a three-dimensional object, which is a jar, right? We put the coronal sagittal planes on, and then we can pour like rooibos tea, weak rooibos tea with no milk. We need a transparent medium, and we have the transverse plane. Then what we do, now we have it in three dimensions. Now we can explore it. We can explore it by, you get a jar, you draw on it. So now immediately you're having contact with a three-dimensional object. And then you draw the jar on paper, but we lead you through this in these videos. I'm just giving you a taste. So you'll draw the different planes on paper, and you'll get an embodied understanding of three-dimensional, what three dimensions are. So just to recap, so three-dimensional spatial awareness is cognitive, it's a mental function. It's a fundamental understanding of what three-dimensional space is. As I say, we have it, but we want to improve it. That's the thing. And anatomy students have a lot of literature where students of anatomy, lots of literature that's been published, have a really hard time with understanding three dimensions. And I see lots of nodding. And so you know it yourselves. And after the talk, I'm going to ask you for your experience. So and then improved spatial awareness, well, you'll tell everyone, leads to improved spatial ability. okay, which is that ability to visualize, mental picture, right? And then the exercises that you're going to do here will improve your spatial skills, patient examination, dissection, and whatever else you do. Another exercise, a piece of fruit. That's called the fruit exercise. What you do is, again, you draw, because you can't dissect a jar, but you can dissect a piece of fruit. And so what we do is you'll follow us dissecting the piece of fruit, and then you draw it. Now, don't think you can't draw, because everyone can draw. You write your name, you draw. And you then look at it, you study the dissection. You can see the little, I've got a laser called that. You can see the dissection, right, of the fruit across the sagittal plane and the transverse plane, and then you draw it. And in that way, you get to, first of all, drawing makes you look really closely at something. And feeling gets you in touch with it. And then you know, there's the consequences are improved spatial awareness understanding. Then Iain will take you through the application in actual anatomy, okay? Now, for spatial, this is your interface. We've got instructions, etc. We take you through an exercise also, again, so each exercise builds. In fact, this is the first exercise. The jar exercise comes later. And this is the first exercise, and it's called the astronaut exercise. And it gives you an experience of moving around in space. So you use your own body, move in space. Then we've got the body exercise, and that also is what you are then asked to imagine yourself, to see yourself in space. And of course, this has implications for when you're looking at a body, you can know where what is inside a body from any perspective. You see a box. So what do we use a box for? This is also to understand space. You put your hand inside of a box, and you are now getting a non-intellectual understanding. You can read about 3D space in a book, but that's not going to improve your understanding of space. So you move your hand around, and as you move with one hand, you make marks on paper with your other hand. And some of the drawings, which I'm going to show you, are exactly, I think you can probably see the space. And this is just from moving the hand around, right? You get to understand space. Oh, so just to say this is a UCT, Newcastle University collaboration. It is supported by our deanery, Professor Lionel Green-Thompson, and there's my colleague Iain and Eleanor, who, I tell you, if it wasn't for her and her enthusiasm, I mean, it just all makes a huge difference. We're all enthusiastic, but anyway, that's a shout out to her, which I don't really need to do, because maybe this isn't a contest. But it's also certificated, okay? So once you complete the course, you get a digital certificate signed by myself and my colleague. He was doctor at the time, now he's professor of anatomy. And that's your certificate, okay? You can print it out as well. Now we're going on to, how are we for time? Let's see.
You've got quite a few minutes.
Oh, good. Okay.
10 minutes?
Okay. That's excluding questions, right?
Excluding.
Great. Okay. This will take me 10 minutes. So now this focus on this, because now why is touch so important? It's such a neglected sense, but it's massively important. So even with an object, whatever object is that we look at in plain sight, there's a lot more in front of us literally than meets our eye. And so we use our hands to feel something, and you must try this with something later on. We to feel it, because you get so much more information and you get different information. And that's what we call observation, whole observation. So observation is multisensory. So I developed a method called you've got to give these things a name, So it's called the haptico-visual observation and drawing method. It's a method, it's practiced, and it works. What is the science behind it? Our hand, right? Who's not seen the homunculus? Who has seen the homunculus before? Okay. It really just shows the amount of afferent nerves from the hand to the brain. How much of the sensory and motor cortexes of the brain are taken up by the hand? So a lot. Same with the feet, same with the tongue. I mean, speech and not choking, but for biological survival. But the point is, for observation, our hand takes up a very large part of the motor and sensory cortexes. Then we have two professors, Roberta Klatsky and Susan Lederman, who identified 6 what they call exploratory procedures. So next time you just in a conversation with them, just hand them something and you'll see immediately they do things. They do this, they do this, they do something. And that is called extracting object properties, okay? When you go and shop for a garment, people go, you see them, they feel the garment. They can see it, but I want to feel it. I wonder, what is it like? Adding more information. So here is just a picture of how it's practiced at UCT in anatomy. We have a course which we do. And here's a student. This is her drawing. You can see how she's using her finger over the hammer while she draws, okay? And what that does is as you trace with your finger, so you move with your other hand. And so you are then, there's a whole other theory about what drawing does, which I'm not going to go into today. I've got a chapter in a book which I'll show you, and you can look at it. It's in the library, and it talks about the semiotic of marks, etc. But that's beyond this particular presentation. If I had an hour, we could do that. So just to say again, here, exploring with a sense of touch, feeling an object. It's a manual gestural activity. And representing it on paper, representing what is felt by drawing, is also a manual gestural activity. So we explore an object with one hand, using the exploratory procedures, not consciously, because we just do it automatically as humans. But we explore, we extract object properties, and then we make corresponding marks with pencil. And I'll show you a little video now of people doing it. Okay. Just to show you, we do it on Zoom as well. This is the University of British Columbia. Students in the certain department. Look how beautiful. And these people had never drawn before. This drawing here is by also a complete person who'd never drawn before, but yet look what's happening here. You look at the hammer, okay. This part you cannot see here. You cannot. This part you cannot see here. But when you're observing in 3 dimensions, look, you can see now on this drawing, this person shows this curve of the hammer, shows this part, shows that. You see? So, but the drawing is secondary. You throw the drawing away if you want. The primary function is to learn about the 3D form of this structure. Same with a drawing of the skull. Look to understand the space inside, to understand, look at the kind of more sort of X-ray feel you get. These are the frontal bones, right? And so if you draw from multiple perspectives, this angle and this angle, you start to include everything in the drawing, and that's how you understand about the relationships of different objects to each other, different sort of anatomical features to each other. Okay? And you get a really incredible understanding of, you get an understanding a very intimate understanding of an object, okay, and in this case, anatomical parts. If you look at this here, like you'll see that the drawing, because a drawing can show the back of a front and front, the drawing, the marks represents the form, okay, okay. Again, studying the face. Study a skull, and then draw the tissue. Then you've got more of a comprehensive thingy. Okay, so more comprehensive, more of a full, more of a, you've got the external volume and the internal volume, you've got it all. So these drawings actually are trying to show, like here, you can kind of see the zygomatic arch, the mandible. It's so, this literally what I did was I looked in a mirror. I had next to me a soft tissue X-ray profile, and I had a skull. And I looked at the skull, not my skull, obviously, but I looked at the skull. It'd be nice to have a 3D printed skull of my own. Yeah. That's a project, yeah. Okay, I'm going to hold you to that. Okay, and then you draw it all, you see. Okay, just to show some more. Oh, this is such a nice video. Let us play this. Now, this video, once the students had all studied the humerus, we formed a line, a row, a line, a cube, and each person had 15 seconds to draw on the same piece of paper. Okay, so let me click here. Now, this is made by student Leila Mohammed. She made this, she put it to music. It's a little bit speeded up, but each person took 15 seconds to observe and draw. Watch their hands feeling and watch their hands drawing. This volume, no, that's okay. What's to music? Volume? No, okay, it's fine. It's very nice music. I'll just watch. Watch what's happening. You see? So everyone just took 15 seconds and feeling 15 seconds each.
No, they're adding to it.
Yes, each person is taking 15 seconds. It's a very fun exercise. But you can see everyone is studying. Who knows the humerus? So, okay. We'll just wait until the end. And by the way, all of these, I should mention this case, but all of the cadaveric material in this presentation are from the collection, the teaching collection of bones. Okay. There we go. And there's the glass. Right, let's go to the next slide. So what are the benefits? So this is called haptico-visual sight and touch observation and drawing. The benefits of the enhanced observation of the three-dimensional form of anatomical parts, memorization of it as a mental picture, improved spatial awareness, etc., and an ability to draw. It's taught in 6 hours over 2 days on Zoom, or there's in person, like at UCT. It's now there's an elective, mark-bearing elective that people can choose to do. There's a special studies module. I've taught it at the University of Cape Town, obviously. Oh, sorry, Newcastle University, at anatomical society conferences in the world, etc., etc. University of British Columbia, etc. So this is what people say about course. I'm just mindful of time. So take a screenshot, or you can watch the recording. Some of our papers we've written. So we've written a on the subject for anatomical sciences education. Recently, a Bloomsbury book, which I'm very chuffed about, because in this book, there are only authors who deal with drawing in health. Okay. And this book sits in UCT library now, in the art library and this medical library. We're very proud of our publication about this. There's another thing which is body painting with palpation. And I've got two, and just whoever would like one can have this. We're coming to acknowledgements and thanks now. Thanks, Prof. Colin.
Thank you, Leonard.
Thank you. And thanks to organizers, Carla and Natasha. And the I team. That's the I team. Okay. Then, of course, to my colleague, Professor Iain Keenan, Newcastle University School of Medicine. We have a very good collaboration, bearing fruit. And, of course, thanking the medical students at our university for contributing their drawings, and the MA students at the University of British Columbia for contributing their drawings. Because we've used cadaveric material that body donors have contributed, we acknowledge with gratitude the contribution of the body donors to the University of Cape Town Division of Clinical Anatomy and Biological Anthropology. Okay, thank you for that. And this is a nice picture of myself and Ian at Newcastle. These are the people who are going to take you through the course. Here's the course. So I don't see any thumbs up scanning the QR code. So here's your opportunity. I didn't say you have an opportunity. So if you want to do it, it's free. Not that you have to do everything free. And there are no strings attached. No one's going to hassle you. There's a discussion board in the course, which you can write on, share drawings with, share your experiences with, ask questions. It's very nice, actually. There's nice engagement that happens there. This is the last slide before we come to the end. So that's just for me. And now we have time for questions.
It's 3 minutes.
Okay.
It's until 4:15, so he's got 10 minutes for questions.
All right.
Yes. So 10 minutes for.
Well, thanks. So yes.
Sorry, I'm saying like.
Yeah.
Wearing gloves to not.
What we do is we wear a glove on the left hand, or whichever hand you want to, one glove to feel around, and you hold your graphite in the other hand.
Yeah.
Of course you can use, it's just nice to have a hand without gloves, but sure, you can use gloves. I mean, look, if you're feeling something, if you're studying something, you should take gloves off, really. If you don't have to have gloves, don't have gloves. But if you're studying like dry bones, don't need gloves. Sure, to answer your question, it does make a bit of a difference to the feeling part. Yeah, a bit of a difference. But when you're wanting to establish, like real prominences, like these condyles, etc., it won't make a difference. Okay, try it and see. Okay. Other question? Yes.
So, out of curiosity, because I'm totally not in the field of art or any kind of drawing, but is there maybe because I can see how this method could be applicable for like if you were drawing faces or skulls or bones, but is there maybe like a sister method to this for softer tissues? So if you had organs, or if you had
absolutely
like leaves or plants or something which is not quite as tactile as a bone or a hammer.
Yes, absolutely. So how do you engage with, for example, the heart?
Yeah, an organ.
It looks like this very organic thing. I mean, of course, there's the coronary arteries and there's the large vessels, etc. So how do you do that? So I got a heart, and how am I going to approach this? Draw the inside empty spaces. Obviously, it's got to be nicely dissected for you to access those spaces. But it's amazing. If you take your fingers for a wet specimen, and you feel around in there. You put your fingers through the aorta, you check out the bicuspid valves, you go into the atria, etc., etc. And it's amazing. And I've never understood the heart when I did that. I can literally now still close my eyes and pretend I'm a little ant crawling around through all the spaces. But that's the point. So those empty spaces. Then, of course, then you go and draw the outside and the different structures on the outside. Does that answer your question?
Yeah,
and
so
of course,
it's essentially you can use this method even for soft tissues, is what
yes,
you're saying,
sure,
with quite a bit of success.
Yes. And also, if you've got soft tissue, we talk about now like a cadaver, right? Or a deceased person, and you open it up, then you can now start to understand the spatial arrangement of things. There's an amazing paper by Madeleine Keenan, and it's called The Importance of Haptics and it's the use of the hand and eye in surgery. So she's big time going for the sense of touch. I usually show it, and I haven't got it in my hoodie. But anyway, yeah. Yeah. Okay. Yes, come on.
So, Leonard, it's one thing to learn about the nature of an object
Critically.
no, category.
Category.
So imagine we learn about skulls.
Yes.
Using your methods. It's the general idea of skull. But is it any good at learning differences between different skulls?
Yes, absolutely. In fact, I normally pack 2 hammers. Now, these hammers, these are drop forged, okay. They cast, all right, but they're hand finished, so they are slightly different. And I'm coming to answer your question about this. So when the students study, each one studies a hammer. I have 25 hammers, and each one gets. And at some point, when they've understood the hammer enough, I take, say, like the new student here, they hand, okay, give me your hammer, okay, and then I put it behind my back, and I take another 2 hammers. I close your eyes, and I give the person 3 hammers like this. As they find your hammer, they find the hammer, of course, because there's subtle differences, you see. Now, if you look at a row of skulls, the variations are phenomenal. So once you, phenomenal, you know, we see these standardized pictures of the human body always, right? And that's the reasons for that, you know. It's a lot of money to make these things, etc. But people are now working, because there's software working on variation. But certainly, if you understand one hammer, you will understand the difference in another one of the same category. Absolutely. So for variation, it very much does that. And say, for example, now I've studied this skull, you know, and I've seen what spaces between here, etc. Then I get another one. Once you've studied one, you'll start noticing the massive differences. That answers the question. Sure, doesn't it? Okay. Okay. Any other questions?
Maybe scroll down in the chat. There is someone.
Ah, thanks for interesting.
I don't know, the one that near below it. Yeah. Here.
Nothing. I wonder, are they in line, but they're just not there?
And then they ask
Screen right
Oh, okay. I've scanned the course. Oh, great. Big thanks for sharing this haptic drawing completely unlocked. Okay. I think I need to photograph that comment. Okay, let me just get that. There you go. And this is, please feel free, Dr. Greenway, to in South Africa, free to like write to me, leonard.shapiro@uct.ac.za.
Leonard, she's in my lab.
She's in your lab. Oh, that's very nice. When I saw green, I thought it's from Greenland or something. Okay. Any other questions? Okay. So yes.
More of a story or comment, I have a question.
Okay.
So I once did a a case, an exhumation in the Northern Cape. So it turned out to be an archaeological case where the person was buried in a sitting position around grave. Obviously, all the bones had collapsed. And I battled to understand the picture of what happened to this person and what was the position that this person was buried in. Because if you're not sure, it can look like mangled remains or mutilated remains. It can just come back together. So I spoke to an archaeologist at the University of Victoria.
Oh, okay. David Morris.
And he told me what you do is you draw it, even on grid paper.
Okay.
You draw it, and when drawing it, it would make more sense to you. You would understand it better, what happened to that body, as it fell in.
Yes.
And I did that, and it really, really made a lot more sense. I could understand more of the positioning of all those remains.
That's fantastic.
So,
Have you still got your drawing?
It's in the case file.
Love to see it. But now that's very interesting also from another point of view. I don't know if you've met Dr. David Morris. He's the head archaeologist in the Northern Cape. But most times people are buried like that. They were Bushmen, Khoisan, that you know, right? That they're buried in that position. Is this correct? Yeah. So just another thought. So it's interesting also to look at the cultural contexts as well. Yeah. Thank you. Okay. Any other? Yes?
No, I was just, do you think it would work for trauma? Like feeling and trying to like draw skeletal trauma.
What kind of trauma?
Skeletal, like I'm looking at cranial trauma.
Okay.
So do you think that would also work?
In deceased people?
Yeah.
Sure. I mean, it will inform you hugely. Tell you a quick story. So I was studying, I remember you saw that picture of the mandibular condyle that I was focused on. So I was drawing this. And then someone came in. This was in the bone storage at UCT. A person doing a PhD in forensic anthropology. She came in. And she said, "Oh, that's not what a condyle looks like." And I said, "Oh, well, have a look. Here's the bone." And she was like, "Oh, okay, hang on a minute." So she found the skull because it had a number on, right? So she found the skull that it went with, right? She said, "Oh, this person had like arthritis type of thing. So it was deformed, right?" And she was like, "Oh, wow, I never noticed that." So, drawing. The rest of case. Okay. Mindful of the time, but if there any, this is a great question. But yes, draw the stuff because first of all, you will see more of that trauma. You will notice more. First of all, look, I mean, drawing forces you to look close and discover more. Yeah. So draw it, but also touch if you can. And touch the inside, under the trauma, and on top. Yes.
So I was just thinking, while it's like what I assume it's mainly the purpose of the HPOT method is to capture something in the 3D form or something.
And understand.
And understand.
Yeah. Mm-hmm.
So how well of a job does it do in terms of capturing details such as like capturing the details of soft tissue? As like can you tell from looking at one of the drawings if something was soft?
Can you tell by what?
Can you tell looking at this drawing if it was soft?
If it was soft.
Like if it had like pliability or something.
Well, if it's okay, if you're drawing a pro-section, plastinated pro-section, and you're drawing actual soft, do you want to answer that question?
No. Okay. Good, but I think you're getting into a realm of drawing that's not about process.
Not about the process.
Yeah, my understanding of Leonard's method, and I was going to say, as an artist and art educator, I 1000% endorse what Leonard is saying. I've seen this over 30 years of teaching students drawing processes. And what I think is so important about what Leonard's and how you've managed to explain something we know inherently as artists, that we learn to just internalize this knowledge, what we call embodied knowledge. It's knowledge that you somehow, and I think within science education, as that could be the great paradox of as much as you're learning about the body in anatomy, you kind of separate it from the body. Like you don't involve your own, you're told not to involve your own body in your learning. And as artists, we're like, involve your own body because you will understand subtle differences, what you were saying earlier, the kind of having free form as a piece of haptically enabled computer software to do facial reconstruction does precisely what you're talking about. You understand there's information you can get from touching the contours of something. You understand whether a muscle attachment was well developed or less well developed, for example. So then you can interpret that information differently. And the kind of embodied knowledge that Leonard's process shares is not about what you can tell from the drawing. That's almost the job of illustration, which is about transferring other kinds of information. This is about the information that you then gather in that process. So that's why you were saying, I love the lack of preciousness. You can just throw these drawings away. However, you learn how to read drawings. What I find fascinating is that for people who haven't drawn before, I mean, I imagine there's a little bit of like, what is the strange chunk of graphite versus a pencil? Because those are the tools that we're used to. You learn how to use that chunky graphite in ways, and you'll see in the drawings people have used lines. Then they've used the edge of the tool to make a kind of a tonal smudge. That is a clue to how that person is sensing material difference. So the hard and the soft, the cool and the warm. You know, if you hold onto a piece of actual human bone versus the cold metal top, or even if you take the hammer, the top of a metal part is going to feel different. It's materially different to the wooden handle. Wooden handle is the wooden handle is warm, or it warms up more easily than the cool part. That temperature difference is also telling something about the material and the hardness and the softness. So anyway, I'm rambling, but it's
that's not. That's beautiful. And when you were talking, I thought, we should like write something up together, do something together, and see what happens.
I did a project. I was invited very kindly by a colleague in anatomy. She does a project where she teaches BSc life science students about facial muscles, facial anatomy, and then they can pick a topic whether they want to represent a particular facial difference or some kind of anatomical feature. And doing this for many years, she wanted a way to get these students past the anxiety of I'm not a sculptor, I can't sculpt, because she was interested in clay modeling. So more the haptic 3-dimensional. So she asked me if I had students that she could pair her third-year life sciences students with as kind of art mentors to kind of get them over the hurdle of like, I'm not going to do well at this because I'm not an artist, because they're not understanding that the outcome is not to make art, the outcome is the process of learning. But we published it in the Journal of Visual Communication in Medicine recently, because she said that there was no doubt that pairing these students with art students alleviated that anxiety enough to like unlock other aspects. So they didn't worry about what they were going to produce at the end. They just got into the process, and then that was effective. They did also happen to also produce better models in the end. But that wasn't the goal. But both parts worked. So there's definitely something to it.
But it might happen that that's great. It might happen, because you asked also about whether it can show softness. Try it. Well, study this process first. By the way, the haptical visual observation and drawing method, it's in the course. But that video is not 12 minutes. Most of our videos are 6, 12, 10 minutes. That's like an hour. So, but to get it, it might look soft. And then take a cross-section, plastic cross-section and soft tissue, but maybe some body tissue, and see, So, yeah. Okay, thank you so much. Thank you so much. Thank you for your attention.
Thank you everyone for the. Thank you everyone for the really interesting questions and discussions. Like, as someone who doesn't do art or drawing much, that was really, really fascinating. And you have a lot of people who are very interested in your course. So,
Good. I hope they do.
we hope to hear from you again.
Yes.
Our next speaker